Sarcoidosis is an autoimmune chronic disorder of unknown origin that affects many different systems, but affects the lungs most commonly. It affects females more commonly than males, with a prevalence of 10 to 40 per 100,000 people in the United States. African American females are more commonly affected than Caucasian females. Most people present with signs of the disease between the ages of 20 to 40. It is characterized by an accumulation of epithelioid granulomas, which contain lymphocytes and macrophages. Any organ can be involved. The most common organs affected other than the lungs include the skin, eyes, liver, and lymph nodes. When the lungs are affected, the alveolar cells are often the target, which causes chronic inflammation that leads to fibrosis or scar tissue in the lungs. This lung damage can then lead to cardiovascular issues such as cor pulmonale and right-sided heart failure. It is also characterized by episodes of relapses and remissions over a span of years.
Sarcoidosis is a chronic multi-system autoimmune disease of inflammation. It can affect any organ, but most often the lungs. In the lungs, the T lymphocytes increase and cause damaging actions in the alveolar. This leads to alveolitis, fibrosis, which reduces lung compliance and gas exchange, which leads to cor pulmonale. In chronic inflammation, there is an accumulation of macrophages, T cells, and inflammatory mediators. This leads to formations of granulomas.
Diagnosis involves a chest X-ray. No blood tests are diagnostic of sarcoidosis, although most affected individuals have elevated levels of angiotensin-converting enzyme. A biopsy of sarcoid lesion in a lymph node or in cells recovered from bronchoalveolar lavage is mandatory to make a definitive diagnosis. Sarcoidosis is often diagnosed while performing a chest X-ray for another reason. Diagnosis is usually made by excluding other diseases first.
Symptoms of sarcoidosis. Many people never have symptoms of sarcoidosis, but if they do, they may experience fever or night sweats, fatigue, anorexia or weight loss. Some people may develop arthritis in the ankles, wrists, knees, and elbows. They may have a cough or shortness of breath and chest discomfort. They may experience a rash called an erythema nodosum, nodules on the surface of the legs. The nonspecific rash can develop on the face, eyes, nose, back, and on the extremities. They may also experience lymph node enlargement.